Over 150 people die from fentanyl-related overdoses. Fentanyl is a powerful drug affecting families and communities. In this speech, I will go over the history of fentanyl and what it is used for, the mortality rates of fentanyl use, fentanyl overdose rescue based on rapid administration of Naloxone, which is a rapid reverse drug for opioid overdoses, also known as Narcan, and what our government and president is doing to fix this situation. Fentanyl today is used as a painkiller. The painkiller is typically used for cancer patients and who experience severe pain. It's not your average painkiller like morphine is. It's a very powerful, potent drug. Fentanyl is approximately 100 times more potent than morphine and 50 times more potent than heroin. This being said, it can be much more addictive since it's so much stronger. Some people have high pain and will receive fentanyl, and often after a tragic accident, it's easier for them to abuse the drug. This being said, like say you're in a car crash and your best friend was in the car and they died. And you've probably seen this in movies, like they get home with the drugs and they start abusing it and their family tries to help them but they can't do anything about it. Fentanyl was first developed in 1959 and introduced in the 1960s as an intravenous anesthetic. It is legally made and distributed in the United States and accordingly to the drug fact sheet by the DEA. Even though it is legally made in the U.S., it is being illegally made in Mexico and being transported over our borders. Chances are, if you broke a bone, ruptured a vessel in your brain, or suffered a bad burn, you'll be given fentanyl in the ER. You need a family member to help you control your drug intake so you won't become addicted because it's very easy to. Fentanyl is a very powerful painkiller, but it's even more powerful when being used and bought on the streets. Labs are making a stronger, more potent version of fentanyl to sell on the streets. It's known as a designer fentanyl. It's deadlier and kills faster. While prescription-based fentanyl is an opioid used to manage pain, acetylfentanyl is an illegal variant of fentanyl and is not a prescription drug. Acetylfentanyl, a white powdery substance, is often sold as a type of heroin. In May of 2013, state officials in Rhode Island recognized that the number of drug overdose deaths have increased and asked CDC epidemiologists to help determine the reason for the increase. Upon investigation, CDC and Rhode Island officials identified acetylfentanyl as the cause of the rise in overdose deaths. Since the investigation, more overdose deaths in Rhode Island have been linked to the drug. Today, the majority of chemicals for illicitly made fentanyl came from China and are synthesized into fentanyl into Mexico. Fentanyl is then smuggled across the borders into the U.S. Our American citizens are bringing the drug across the borders to the U.S. According to the article Illicit Fentanyl and Drug Smuggling at the U.S. Border by Christian, 86% of fentanyl trafficking convictions are U.S. citizens. The Border Patrol and small-town police are always searching for major traffickers, and our government is currently acting more forcefully to address these issues directly. The government is currently acting to help the drug abuse. They are putting together police teams for drug trafficking problems and open up rehab centers across the nation and so much more. For the fiscal year of 2024, the Biden administration has asked the Congress for a historic $46.1 billion for National Drug Control Policy agents to continue expanding prevention, treatment, and recovery support services for $40 million to combat fentanyl trafficking and distribution of transnational criminal organizations. We passed the rule that focuses on reducing overdose deaths. We passed the Baptism Fentanyl Results Act, which authorizes 2 State Department programs that combat global drug trafficking. They're also fixing the problem by flagging patients who come in acting in pain, but they're really just wanting to be prescribed drugs. So when you search that person up in the medical system at any hospital around the world, they'll be flagged and you know that they're drug addicts. I mean, it is kind of bad because they could actually be in pain, but it's also helping us so much more with that. A federal jury yesterday convicted family medical physician Donald Savo of 12 counts of distributing the controlled substances oxycodone and hydrocodone outside his practice and without a legitimate medical purpose, announced United States Attorney in 2023. Over the past 5 years, 115 doctors have been convicted of giving out prescribed drugs under the counter. And on September 22nd, members of the Brandon Police Department Narcotics Unit, DEA, MBN, and the Mississippi Board of Medical Licenses arrested Dr. Stephen Tincher at Merit Health Rankin and Brandon. Tincher is charged with 2 counts of trafficking of controlled substances and 1 count of sale of a controlled substance. The fentanyl crisis highlights the urgent need to comprehensive approaches addressing both supply and demand sides of the issue. Effective solutions must involve healthcare, law enforcement, and community-based interventions to prevent further devastation from this deadly synthetic opioid. I've discussed the history and medical uses of fentanyl, emphasizing its alarming mortality rates due to misuse. I've also highlighted the importance of Nexplanon, also known as Narcan, in rescuing individuals from fentanyl overdoses. Lastly, I've talked about the governmental and presidential efforts aimed at addressing and resolving the fentanyl crisis.